When they saw the conditions, how bad it was, they almost passed out. And when I told them they were spending $500,000 a day, that's $180 million a year, they did pass out.
In the studio with me, I have a very special guest, Judge Stephen Liefman out of Miami-Dade, Judge T. Patterson Maney. We were discussing solutions and alternatives to mentally ill. Instead of incarcerating them, how can we solve this problem in a way that would be not only more humane for those who need this care, but also save taxpayer dollars and decrease our jail population? Thanks for joining us. Well, thank you so much for joining us today. We have in the studio with us Judge Liefman from Miami-Dade. He has a tremendous background. He was very interested in trying to solve the mental health issues that face Florida, and we'll come back to that in a moment. But we also have with us now retired Judge Maney, T. Patterson Maney. Many of you know him as our county judge, but also as a local war hero who spent a number of years in Afghanistan, setting up the election there. He began not only the Veterans Court here, but also the Mental Health Court.
Well, thank you so much, and equally important, thank you for your leadership on this issue, because that's how this gets fixed. It really takes one person to understand what the issue is and use their moral authority and your governmental authority to fix it, because the reality is, while this is a very serious crisis, it's fixable. There are about 2 million arrests each year involving people with mental illnesses in this country. And on any given day, we have almost 400,000 people with serious mental illnesses in custody and another 800,000 on some type of correctional supervision. And the reality is that they're not a dangerous population generally. People with mental illnesses are no more dangerous than the general population. And on medication, frankly, they're a lot less dangerous than the general population. And people need to understand that recovery rates for this population is really great. It's better than for heart disease and diabetes. The key is, like any illnesses, or any illness, is to identify it early and get it treated. And sadly, about 92% of all the women in jail and prison in the United States with serious mental illnesses were sexually abused as children. And about 75% of men who are in jail and prison in the United States with serious mental illnesses also have very serious trauma histories. And unfortunately, instead of identifying what was causing their behavior, we punished the behavior and in many ways made it worse and allowed a lot of these young people to grow up into our criminal system by allowing their illness to get worse. Instead, what we need to do now, and what your commission's poised to do, is to start helping identify these issues earlier, getting people treated earlier, and keeping them from going into these deep-ended, acute, expensive systems, but more importantly, helping them get a life, have hope, have opportunity, be a contributing member of society.
So this is very exciting today. I think that we have the momentum going. What came out of today's commission meeting is that our next step will be a summit. And you're going to be involved in that, and you kind of gave us this is what you need to do to create a summit. So you want to talk a little bit about what you've done in Miami-Dade with the summit. What does that mean?
After I had a really difficult case in court where it turned out the defendant, who was charged with a very low-level offense, was a Harvard-educated psychiatrist who had a late onset of schizophrenia. And it really, for me, was a window into what was wrong with our system. Us so-called, stakeholders and policymakers had developed a system that was designed to fail. And it was hurting people, and it was expensive, and it was endangering public safety. And we knew that there was already research and science that showed us there was a better way to go that could get us much better outcomes. And so we first mapped out the process. We realized where the gaps in our system were, and then we began to attack those gaps. Now, we've had tremendous success. It's taken 19 years. But in the first 2 years, we saw tremendous improvement in what we were doing. And our recidivism dropped immediately from about 72 to 20%. Our misdemeanor population. And we realized by talking to the jail and doing some analysis that 10% of the misdemeanors misdemeanants with serious mental illnesses in our jail were making up 70% of the jail bed days.
And that's important, and this is something we want the public to know. We're at a point with the Okaloosa County Jail, and I think that Judge Maney here is somebody who could really speak to this.
Today, we have 767 in a jail that's designed for 594, which means the cells, the living areas are overcrowded. There's not enough bed space, and it creates a legal liability for the county and its taxpayers. So it's an issue that we've dealt with before. The county was sued back in the 70s for jail overcrowding. We have to deploy our dollars and therefore our jail beds in a smart way so that we can keep the people in jail who need to be in jail to protect the public. And we need to keep the people out of jail who are not a danger to the public. And for that subset then of people who have mental illness, we need to get them treatment so that they don't go to jail in the first place. And if they have gone to jail, if they are in jail, they get treatment when they get out so they don't come back.
We also set up a couple post-arrest programs. So we changed the screening tool at the jail, so we do a better job identifying those with serious mental illnesses. And when appropriate, we get them out of custody very quickly. We get them to a treatment facility, and then we get them into a continuity of care and monitor them by the court. And it works. Our recidivism rate dropped from 72 to 20%. The jail audit went from about 7,300 to 4,000. The number of arrests in Dade County went down from 118,000 to 56,000. You know, was all of this due to our program? Probably not, but a large part of it was. And it's showing the dividends, and it's helping educate our community. And what you're doing here today with your radio show and the TV is a main part of how we get this fixed. Because when the press brought that issue to the attention of the community, it changed everything. They became more sympathetic. And so one of the things that I did is I invited the mayor and all my county commissioners to the jail to see the mental health floors. And I joke, but it's serious. When they saw the conditions, how bad it was, they almost passed out. And when I told them they were spending $500,000 a day, that's $180 million a year, they did pass out. They had no idea that they were spending all that money on this population, that they were getting terrible outcomes, and that people were being treated, you know, like Abu Ghraib. It was horrible.
These are ideas, but people aren't sure. I mean, I saw lights go on across the dais today as people realized we can do something different. This is a better idea.
So when we started, we had no grand plan. This had never been done. We had no model to follow. We didn't really know exactly what we were doing. We just knew what we were doing was wrong and there was a better way. And so what we're doing right now is we're about to begin on May 31st of this year, in a few weeks, the groundbreaking of the first of its kind mental health diversion facility. It has this magnificent 5,000 square foot kitchen, so we're turning it into a culinary supportive employment program so we can help people get jobs and have self-worth and get back to the community and be good tax-paying citizens again. So it's going to have primary health care, it's going to have dental, it's going to have eye. It'll also have a courtroom, and so that we can manage the cases, and it'll offer trauma services. It'll have training rooms. We can do CIT training. And the idea, and it'll have housing, up to about 200 units. So the idea is instead of just discharging people to the street who are still sick and kicking them to the curb and, you know, putting the burden on sick people to get recovery, we will gently reintegrate people with all the supports and services they need to recover. Plus, one of the other critical factors in mental health, there are no really good treatment protocols. You go to a psychiatrist, often they're going to give you the least expensive medication, depending if you can find one.
We only have 4 in our community.
There's a real shortage nationally, and so telepsychiatry has to be part of your solution. But they don't have good protocols. So God forbid you have breast cancer. It doesn't matter if you're in Mississippi, Miami, or Alaska. There's a protocol. They're going to start with X treatment that they know is going to have the best results. So we're going to do very serious research in this facility as well to help the psychiatric community figure out what are the best treatment protocols, what they should be using.
This would make, this would be such a great bow for me to put on the end of my career, so to speak, in that I was part of the JFK when he deinstitutionalized, believing, as you so eloquently spoke about last night, as his own sister had gone through a lobotomy, and he thought he was doing the right thing by deinstitutionalizing these houses of horror, basically, where people were housed and institutionalized, and they were horrible when I went into them. And then they fell on the streets
But
because there
remember-
wasn't any funding
Right,
attached to it.
Congress
Never funded it,
appropriated
well,
it.
because of
He
Vietnam and
authorized $3 billion, which is even a lot of money today, and it never got appropriated. And so it's been a hodgepodge of community mental health systems, and the courts were the ones that basically ordered some of the deinstitutionalization because of the mistreatment in these hospitals. And so it created this bizarre perfect storm. And then we went to the war on drugs and the war on crime, and we cut housing substantially in the 80s. And all those things have contributed to this disaster. But, you know, it's a wonderful legacy for you to leave. And I think it makes a significant difference in all these people's lives. And, you know, look, we're learning more. We know more about the brain today than we did just 10 years ago. To other policymakers, which will translate to more money to move into this, because we need to treat this like any other illness. I mean, you wouldn't treat people with cancer or heart disease this way. Why are we treating people with these illnesses this way?
absolutely.
And so it's the right thing to do. Everybody benefits. It improves your public safety. It saves taxpayer dollars, and it helps people get their lives together. There's no reason not to do it.
That pretty well sums it up. Judge Maney, do you have anything to add as we close the program today?
The only thing I would add is I think this program offers the opportunity to the county to not only save money, but to shift some of the cost by lowering the cost of incarceration, avoiding the cost of building a new jail, by not incarcerating people who don't have to be incarcerated. We can save the medical care cost for those people who are no longer incarcerated. And we can generally improve public safety. I mean, to me, it's something that has to be done. We don't need to build a new jail if we can get folks out of jail or avoid going to jail, and give them a structure if they have gone to jail where they don't come back.
Thank you so much, Judge Maney, for joining us today. And of course, Judge Liefman, it has
Thank
been
you.
just a pleasure to hear you address last night and today. Thank you for your work that you're doing, and we all look forward to solving our problems in Okaloosa County with you, with your
Thank you.
guidance.
We wanted to-